of course, the government has been borrowing. The government is not collecting as much as it should. Surely there is a challenge in that front. He started his speech yesterday by talking about corruption, sealing loopholes in corruption. Of course, we've had him talk about corruption in previous years. Did he do himself justice in his first term in the manner in which he tackled corruption? Because there are people who feel that if at all you tackle corruption properly, then probably you would have some of the funds needed to execute some of these projects.
Very true indeed. Given that he has gone to the international market, Eurobond 1, he would have used that opportunity to say that Eurobond 1 we achieved or we spent on the following programs and projects. Then he would have said that because I've borrowed Eurobond 2, I want to spend Eurobond on the following projects and programs to achieve my 4 agenda items. I want to create probably public-private partnerships on the issues of housing and so on, so that we are told how it's going to be done. Otherwise, when he leaves it the way he did, it is not different from the days when you were at high school and you were dreaming that you would get a girlfriend and you tell her, I can buy you a plane. When I marry you, I will give you a 5-bedroom house and so on. I mean, it's nothing.
Senator, do you feel...
And I don't know why Wamatangi is falling for it. Is it because he's senator?
But Senator, do you agree that the president was a bit vague when it came to how he was going to go about? Probably he knows, yes, and probably he figured it's not the place to actually expound on it. But do you agree that he was vague in as far as how he is going to execute this?
Well, remember that when the president is giving the State of the Nation address, he's actually summarizing the plans, achievements, and projections of a government for the next 365 days in less than 2 hours. I mean, and so if you're expecting that within that probably an hour and something, he is going to talk about everything in detail and break down in figures and balances, then we're not being realistic.
Not necessarily in figures and balances, but even an indication of where the funds will come from.
Let me finish. See, already he's speaking to Kenyans who are in this country, and even those who are not are able to follow, and they do follow. Since the launch of his 4-pillar quest, there has been continuous education, discussion, and engagements on how are we going to do it, who is going to be involved, what will require to be done. That debate has been ongoing all the time, and so what he would be doing is probably just going through it to remind the people that he's still committed to that cause. But if you ask me, I'm the chairman of Roads, Transport and Infrastructure in the Senate. This morning, actually, I'm leaving this place and going for a meeting of a discussion of the Nairobi Metropolitan, the urban bill. It's called Namata Bill. That will be seeing quite a lot of things happening within the Metropolitan, not only Nairobi, but the other 5 counties that are around the Metropolitan. And so a lot of things are happening. So many people are involved. There has been a lot of discussion in detail in so many other forums. And so what I would want to tell my good friend here is that at this time, what we would need to do is to take the speech for what it is, and it is an address outlining the achievement, the focus and goals of government and the expectations of the people. I believe in as far as the details of how it's going to be done, we can be able to expound on it. That's why he has got cabinet secretaries. That's why he's got PSs. So that's why there are leaders in
we
parliament.
We are in agreement that President Uhuru Kenyatta definitely just used yesterday's speech to set a platform to roll out his Big Four agenda, not necessarily to break it down on how he's going to do it.
Well, in that context, probably to the best that it can be done, and you can either call it an outline, you can call it anything else. But I think the best way, in my view, to put it is that he brought to the fore the key issues, the focus where it should be. Okay. And I believe then we can pick it up from there, implement, those who are supposed to implement. Let's discuss it, those who want to discuss it, and then follow through to have it actualized. Okay.
You know, my brother, you're being dishonest when you say that in 2 hours the president does not have sufficient time to speak to what he wants to do in the next 12 months. You're being dishonest. There is something which all of us know and which we were taught very well, called précis. When you are speaking, you must be able to use the principle of précis to ensure that you deliver. And as they say, if you cannot say it in 10 minutes, then you can never say it. Let me come to the point you have raised of the issue of the pillar. And let me go specifically to the issue of health, where I'm an expert. I would have expected the president to go slightly further and say that because he attempted to point to healthcare, yes, when he was trying to blame the county governors. He should have, Wamatangi, told Kenyans that in view of the fact that health is fully devolved, my national government is going to create this kind of partnership by making the following interceptions with the county governments to support the county governments to succeed on healthcare. And then he would have used that opportunity to speak to the issue of the human resource, because the president is on record and it has come to pass that he's gone to Cuba, yes, and brought probably 100, 200 yes, Cuban doctors to a country, Wamatangi, which has got 2,700 qualified doctors that have not been absorbed by the government. So when he then says he's going to get doctors from Cuba, when he has not hired the Kenyan doctors, it shows a president who has lost touch with what is going on, because we as doctors, we are in shock that he is not employing our young doctors. Instead, he's going to Cuba to bring people who do not speak English, who do not speak Swahili or any of the 42 Kenyan local languages. So it's going to be very cumbersome for these people to discharge medicine. They will have to sit with somebody next to them to try and interpret what the patients are saying. And then finally, he would have told us how he is going to ensure that the wastage of funds in healthcare that goes to curative services on areas where, if the same amount of money had been invested into primary health care, these patients would not have become sick in the first place. So he is our president. We do not have another one. So which is this other president you want to speak to these issues? And yet those are the issues that touch the very fundamental requirements of a good life.
Senator,
he said,
just
in conclusion, he said that his dream, and I really want to thank him for that, his dream is for every Kenyan to have a decent, did he say earning or something, for himself. That's a very good dream. But please, people who are sick perpetually, people who are dying, people who are unable to go to school cannot move into his dream of earning a decent living.
Senator. I would probably just try to cut across through what my good friend here, Bonnie, says, but definitely, not say it correctly or honestly, for that matter. One, Bonnie has been a senator with me in the Senate, and I believe he still has the good mind to be one. Only that I know he's eyeing to be the governor of Kakamega. Wish him well in the next battle. But he knows that health is a fully devolved function, and this is the responsibility of county government. Actually, when national government has had to intervene in the operations or the rollout of that function in the counties, it is out of concern that it has not. Actually, that question Fred, has been there, out in the public domain. Should health have been fully devolved to the counties? I mean, do they have the capacity or capability to handle the complexity of healthcare with, you know, to the satisfaction of Wananchi? And so when the president picked out on some of those things, for example, you know, the intervention to take equipment to hospitals, and on this specific issue that Bonnie is raising about the number of doctors within our country, it is common knowledge, Fred, that with as many doctors as we have, as is being counted by my friend Bonnie Halwale, that according to the international standard, the international requirement, the number of Kenyans that you should attach to a doctor, we are way below. We have very few doctors for that matter. And so any intervention that we'll be getting, whether from left or right or south or north, would be welcome if it is going to address the issues that we have. I mean, for example, look at present day Kenya, Fred, when every day when you go to the village, the first thing you get is a call from your neighbor that come and help us to do a harambe because our daughter or our mother is going to hospital. And ask yourself, what is the current outreach of probably, let's say, you know, a fund like NHIF? I mean, what else would be done? And so, you know, on the issues of healthcare, would be failing if we, you know, just spinned it on the top to make a certain impression and not address the issues. Okay. And I would want to correct you on that perception about doctors, especially the Cuban doctors. You know, it is not the first time. When we were growing up, actually, not only doctors, Fred, if you go around even schools, you will find that many times, I don't know why you went to school, Fred, but there were so many teachers, even those days, even now. Some you find, you go to a school there, you find a Cuban, you know, teacher who's in a certain school. You find a British teacher who is in a certain school. There is that kind of exchange. So if you look at the number of doctors we are talking about and the requirement of the country to be able to provide proper health care at the standard required, you're talking about a drop in the ocean. It is not an issue.
I'm sure you want to respond to that before we take a break.
You know, I must. When you mention the critical issue of access to health care, in fact, the president said access to affordable health care. Very quickly on mind is, how do I do it? And Wamatangi, this is why we have the principle of insurance. National Insurance Health, National Health Insurance Fund. So when now the government of President Uhuru wants to address that problem, you know what they do? They come and make a populist statement that all high school children will be, the government will pay NHIF for all those children. How so myopic? Why? Because if you pay for the father, then automatically the cover of the father will cover for all his children. Instead, they then go in a family, like in Kakamega, where we have got an average of 8 to 11 children per family. You pick only one boy who is in high school, you give him insurance, and leave 10 of them exposed. If you had given the father that, you had paid for the father that insurance, then automatically he'll cover for the boy in high school and he'll also cover the balance of the sibling. Talk to health
you know, Bonnie, on that one, you know, I agree with you to only one extent.
Okay.
That you are a doctor. There is no dispute about that. That you can take somebody to the laboratory and cut through their muscles, you know, to theater. That one we have no dispute about. But about policy, we must take a second look at that. You know why? For example, you know, Bonnie, you cannot get sick on behalf of somebody else. So I mean, when you're saying that if you insure the father, then you have insured the son, that's not correct. I mean, even yourself, when you're a member of parliament, you know, when you're given insurance, you're actually told, specify as a member of parliament, and you are limited to this number. Now, what we would need to be saying is that every Kenyan is entitled to health care.
Okay.
And you see, what the argument you try to bring is, it would be expanded. Can we look at a way that we would expand beyond high school or secondary school students in insurance, and not specifically just narrow down to them, but it is a journey. It is one step. Once you have dealt with those ones, can you deal with the next? I mean, because we don't have it. That's the point. So we must start somewhere.